Everyone has stomach problems every once in a while. You know, you have that yummy burrito at night, and all of a sudden, that heartburn is really eating me up inside. But how do you know if your stomach pain is a sign of something else that's more serious? Maybe something more than the occasional Tums or Roloids can take care of. In today's video, we're going to discuss stomach cancer. We'll discuss exactly what is it, what causes stomach cancer, what are the symptoms of stomach cancer, and at the very end of the video, I'll go over my tips and what I recommend for you to minimize or eliminate your risk for developing this deadly disease. Guys, let's talk about poop. Howdy y'all, Dr. Islam here, aka your poop guru, trying to give you the best tips and tricks so you can live your best life from the top all the way down to your bottom. If you haven't already, don't forget to smash that like button, like, share, and subscribe so you get more tips like you're watching in today's video. So before we begin, I want to talk to you about a patient of mine named Jason. Now Jason knew for a long time that something just wasn't right. He had a lot of heartburn, reflux, but it got worse when he had also stomach pain that did not get better with over-the-counter treatments. In fact, Jason knew that this may be something worse because he did not get better despite being on the typical treatment when it comes to acid reflux or heartburn. In fact, he started to notice his appetite changed. He wasn't eating as much. He was losing a lot of weight, and this got him really worried. So Jason got referred to me to find out exactly what's going on, and when I talked to him, he had what are called warning signs, what made me worry and wonder, is there something else going on inside his GI tract that may be something deadly? So whenever I did the endoscopy, unfortunately, I confirmed our worst fear. Jason had stomach cancer. Now Jason's still going through treatment now, and we're hoping he can make a good recovery. Stomach cancer, what exactly is this? For some individuals, whether it's due to genetics, diet, or other risk factors, which we'll talk about soon, the cells over time can actually mutate into precancerous cells. And that mutation continues until eventually the lining of the stomach actually progresses into cancer of the stomach as well. Now your stomach is a mammalian organ that's there to churn things down and break down food into its smallest component. And it uses the whole entire stomach to do that process. Stomach cancer can actually occur anywhere inside that stomach, and the location of stomach cancer can present with different symptoms depending on the individual and the location. And that location also can determine what type of treatment we offer for our patients. So what exactly causes stomach cancer? We know it comes down to irreversible and reversible causes. So the irreversible causes are things that you and I cannot control. One of them is genetics. If you have a strong family history of stomach cancer, whether it's a first-degree relative or multiple second-degree or third-degree relatives, this will put you at a high risk of developing stomach cancer. There most likely is a gene that's passed on that can increase your risk. Number two is your ethnicity. We know that people who live in the Asian continent tend to have a higher risk of developing stomach cancer. And this is why we recommend universal screening for those individuals or those ethnicities to help minimize or prevent stomach cancer. We know that age plays a role as well. The older that you are, the more likely it's going to be for those cells to mutate and cause stomach cancer. But don't worry, there are reversible causes that you can take care of to minimize or eliminate your risk. One of them is an infection called H. pylori. So H. pylori is a bacterial infection that is probably one of the more common reasons why people get stomach cancer. And treating this infection can reverse that cause and decrease your risk for developing that cancer. So if you're worried about having gastric cancer, get tested and treated for H. pylori. Number two is obesity. We know that obesity is a risk factor for multiple cancers, not only stomach cancer, esophageal cancer, colon cancer, liver cancer, gallbladder cancer, pancreas cancer. And if you can get that weight down, minimize that risk factor, you're going to decrease your risk for developing this cancer. Number three is food. We know a diet that's high in high salt, smoked foods, beef, and meat can increase your risk for developing stomach cancer. So if you want to do something to help decrease your risk for developing stomach cancer, alter and adjust your diet. Smoking, I mean, come on guys. There's no way you should be smoking in this day and age. Smoking sucks. It's not good for you, and this can substantially increase your risk for developing stomach cancer. And then lastly, long-term inflammation to your stomach, whether it's gastritis. And there are a lot of reasons why you can have gastritis, whether it's smoking, like I mentioned before, alcohol, medications like non-steroidal anti-inflammatory medications, or other conditions that can increase the inflammation inside your GI tract. If you can minimize those risk factors for gastritis, you're going to also minimize your risk factors for developing stomach cancer. So what are the main symptoms of stomach cancer? Well, in actuality, it is hard to diagnose. You have to have a good clinical suspicion. Sometimes you may have vague symptoms, just kind of a little bit of pain, a little nausea, not feeling very good. But unfortunately, that's a symptom for a lot of different things that are typically benign. But what gets the red flags up in my head is if you have what are called warning signs. You get full very quickly or early satiety. You have black stools or anemia. You just don't feel very good. You have the stomach pain that does not go away. You try acid medications and it doesn't resolve your symptoms. You're starting to lose weight, and especially if it's unintentional weight loss. These are red flags in my mind that makes me think that something else is going on inside your body. So is there anything that you can do today to minimize your risk for developing stomach cancer? Here are 5 things I recommend. Number 1, you have to maintain a healthy weight. That obesity, that big belly, really causes so much inflammation inside your body that this is one of the easiest things that you can do to decrease your risk, not only for stomach cancer, but all the other cancers that are out there, whether it's exercise, diet, medical therapy, or even surgical therapy. Do what you can to keep that weight down and minimize or eliminate your risk for stomach cancer. Number 2, minimize or eliminate meats. You know, watching my videos, that meat, especially beef and smoked foods, can really increase the amount of inflammation inside your GI tract. It alters your gut microbiome and also can alter the DNA in your stomach to make it more likely for you to have stomach cancer. Number 3, have a diet that has a lot of variety of plants and vegetables. These are pro-inflammatory antioxidants to keep the inflammation down. It'll improve your gut microbiome, get you feeling better, and hopefully minimize or decrease your risk for stomach cancer. Number 4, if you smoke, stop. I mean, come on guys, there is nothing good about smoking. Don't do it. It's not good for you. It is terrible for your gut and your health. And then lastly, ask your doctor or someone like me about what your risk factor is for stomach cancer. We can help out with that. We can determine your family history, your ethnicity, your risk factor for having gastritis. We can put this all together to find out exactly what your risk is so we can do what we can to minimize it and get that taken care of for you. And for those individuals that have a high risk factor, I'll take a look with a scope, I'll see what's going on, and hopefully find out what we can do to get you taken care of. So here's my call to action to you. Listen and watch this video and review again what those risk factors are. What can you change? What can you not change? And what can you do to minimize your risk? And if you have a risk factor, come see someone like me so we can do further investigation for what's going on. My question of the day for you, what are your questions you have about stomach cancer, about the risk factors, or what you can do to minimize your risk for developing this cancer? Comment down below. I would love to hear what you have to say. But thank you for watching. Don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my channel where I give you great tips and tricks like you're learning in today's video. And if you want to learn more about gastritis or H. pylori, I'll put a link to those videos so you can learn more about what you can do to minimize your risk. Guys, thank you for watching. Don't forget, let's talk about poop. Thanks everybody.